So begin with general microbiology. In general microbiology, these topics, culture media, blood spill, and sterilization and disinfection are the most important topics. So let's move on to our first question from sterilization and disinfection. So our first question is endoscope is sterilized by, and these are the options. Okay, so you should know that endoscope is an instrument used for internal examination of patients. And these instruments are made up of tubes and lenses, making them heat sensitive. Means if you use high temperature, the instrument may get damaged. Therefore, we cannot use high temperature sterilization methods for such instruments like endoscopes, bronchoscopes, cystoscopes. So, how do we sterilize these instruments? Well, these instruments require high level disinfectants. Why high level? Because these instruments come into direct contact with the mucous membrane of the human body. So we must use high level disinfectant to eliminate bacteria, viruses, fungi, and even spores. So, to answer this question correctly, you must know the examples of high level disinfectants and which include glutaraldehyde. This is the most commonly used one for endoscopes. Second, OPA, hydrogen peroxide. So, these are the examples of high level disinfectant. Let's analyze the options. Number one, autoclave. Absolutely no, because autoclaving is a moist heat based method which could damage the endoscope. Number two, hot air oven. Not at all. Hot air oven based on dry heat sterilization method. Number three, inspissation. Inspissation method is used for sterilization of egg and serum based media, and this is not for heat sensitive instruments. And fourth option, glutaraldehyde, and this is the correct answer. Okay, so our next question is a patient presents with fever and chronic cough. The doctor performs a chest x ray which is suggestive of tuberculosis. Then a sputum smear test is performed and it is found to be negative for acid fast bacilli, meaning no TB bacteria are seen. So the question is, what should be the next step to confirm tuberculosis? So this is the scenario. The X-ray suggestive of tuberculosis, but the smear preparation is negative. And these are the options. Okay, so to answer this question, we must follow the TB diagnostic algorithm. And according to TB diagnostic algorithm, the first step in TB diagnosis is the sputum smear microscopy and chest X-ray, which have been already performed in this case. And the next step here is CB-NAT. CB-NAT is the best next step and it's performed in both the cases, whether the sputum smear is positive or negative. So let's quickly understand what CB-NAT is and why it is the best next step. CB-NAT stands for cartridge-based nucleic acid amplification test. In short, it is an automated PCR test that detects Mycobacterium tuberculosis DNA in the sample. And why is the CB-NAT the best next step? Because it is highly sensitive. It can detect TB even when the smear test is negative. And second, it provides rapid results within a few hours. And the third important, it can help in deciding the best treatment for the patient. It detects rifampicin resistance as well. So the CB-NAT is the best choice for confirming tuberculosis. Let's go through the options one by one. They have given repeat sputum smear, not useful since the first smear was already negative. Second, sputum culture. Sputum culture, it is a gold standard method, but this method takes weeks to give results. So no for sputum culture as well. Third, line probe assay. Line probe assay, this is used for drug resistant testing and only after TB has been confirmed. And last, CB-NAT. And CB-NAT is the correct answer. This is the next best step for TB confirmation. Okay, so our third question. A 45-year-old farmer presents with complaints of high-grade fever with chills, retroorbital pain, and conjunctival suffusion. And on examination, there is a severe calf tenderness, and lab investigations reveal hypokalemia and neutropenia. And these are the options. So let's quickly focus on the key clues. Number one, occupation. The patient is a farmer. So whenever an occupation is mentioned, we should think about diseases related to that occupation. So farmers are often exposed to animals, contaminated food, water, and these increases their risk for certain infections. And the major clue here is conjunctival suffusion and calf tenderness. These two symptoms are the classic signs of leptospirosis. Conjunctival suffusion refers to redness in the eyes without pus, and this is a hallmark of leptospirosis. And second, severe calf tenderness, and this also commonly seen in leptospirosis. All right, let's quickly analyze the answer choices. Number one, dengue. So, the presence of retroorbital pain might make some students think of dengue, but dengue does not cause conjunctival suffusion. Okay, so remember this. And also, dengue has some other hallmark features like nausea, fever, rashes, and thrombocytopenia, which are absent in this case. So, dengue is not the answer here. Second, chikungunya. Chikungunya present with fever and joint pain, but the joint pain is typically crippling and severe, which is not mentioned in this case. And chikungunya does not cause conjunctival suffusion, which is the key finding here. So chikungunya is not the correct answer. Third, leptospirosis. Leptospirosis is caused by a bacteria Leptospira, and it is transmitted to humans through contaminated water and animal urine, especially from rodents. And farmers are the higher risk of exposure to leptospira due to their work environment. And conjunctival suffusion and calf tenderness are the hallmark symptoms of leptospirosis. And hypokalemia and neutropenia are also common finding in severe cases of leptospirosis. So since all these findings match our case, so leptospirosis is the most probable diagnosis. Malaria, again, malaria can cause fever and chills, but it does not cause conjunctival suffusion. So malaria is not the answer. All right, this is our last question. Which of the following is incorrect regarding the disease association of parvovirus B19 with the respective patients? And these are the options. So, in this question, they are asking which complication is not related to parvovirus B19. So, let me tell you, this parvovirus is a very, very important topic for your exam. So, don't overlook it. All right. Now, quickly analyze the options carefully. The first option says child erythema infectiosum, and this complication is caused by parvovirus B19. Erythema infectiosum, it is characterized by slap cheek rash on the face and a lacy rash on the body, and it is also known as fifth disease or slap cheek syndrome. So, this complication is caused by parvovirus. Okay. The second option say hemolytic anemia, aplastic crisis. Again, this complication is caused by parvovirus B19. Parvovirus stop red blood cell production for a short time, but in patient with pre-existing conditions like sickle cell diseases or thalassemia, they can cause severe anemia known as aplastic crisis. So again, this option is related to parvovirus. Now let's look at the third option, pregnant non-immune fetal hydrops. It is also caused by parvovirus B19. If a pregnant woman gets infected with parvovirus and she is not immune, the virus can infect the baby and cause severe anemia, heart failure, accumulation of fluid in the fetus, and leading to fetal hydrops. And this is a very well known complication of parvovirus B19 in pregnancy. So again, this is related to parvovirus. Finally, the last option, young females polymyalgia rheumatica, and this is not caused by parvovirus. This disease, it is an autoimmune and age-related disease, and it is not caused by parvovirus. So option D is the answer. Alright, that's all for this video. If you found it helpful, don't forget to hit the like button, subscribe to my channel, and share the video with your friends. Thanks for watching. See you in the next one. Hello everyone. Today we will discuss important MCQs questions frequently asked in competitive exams, and I will explain each question step by step along with some useful tricks, so make sure to stay with us until the end. Let's get started. Let's begin with a question from General Microbiology. In General Microbiology, many questions focus on sterilization topic and blood spill management. For example, let's look at this MCQ question. A patient was involved in a road traffic accident and was brought to the emergency room. The patient expectorated blood onto the floor. So which disinfectant should be used to clean the blood spill? So this question pertains to blood spill management, and we must know the appropriate disinfectant for cleaning the blood spill is sodium hypochlorite, which is a bleaching agent that effectively disinfects surface. So the correct answer here is sodium hypochlorite, and the ideal concentration for this purpose is 0.5%, which is commonly used in hospitals for cleaning the blood spills. Okay, so second question is, which of the following statements is true about Trichomonas vaginalis? Options: it is not an sexual transmitted infection. Number 2, wet saline mound of vaginal secretions show cyst. Number 3, twitching motility seen on wet saline mound. Number 4, it cannot be cultured. Okay, so first of all, we must understand that this Trichomonas vaginalis, it is a parasitic protozoa and it is responsible for causing trichomonasis, and which is the most common parasitic sexual transmitted infection. So the option 1, it is not an STI. This statement is absolutely incorrect because Trichomonas vaginalis is transmitted through sexual contact. Then second option, secretion shows cyst. Again, this option is absolutely wrong because Trichomonas vaginalis does not have a cystic stage. It only exists in a trophozoite stage. Okay, then option number 3, twitching motility seen on wet saline mound, and this option is absolutely correct. Trichomonas vaginalis belongs to the flagellate category, means it has flagella for movement, and on a wet mound it shows characteristic twitching or jerky kind of motility, which is a key diagnostic feature. The last option, it cannot be cultured. Again, this statement is wrong. Many students assume that only bacteria can be cultured, but this is incorrect. Many protozoa parasite can also be cultured using specific media. Here in case of Trichomonas vaginalis, it can be cultured on diamonds media. So option C is the correct answer here. Okay, all right. The third question is, a 32-year-old patient presents with fatigue, abdominal discomfort, and an itchy rash on the feet. The patient frequently walks barefoot. On examination, there is a linear serpiginous erythematous rash, and the patient also reports early respiratory symptoms. Which clinical manifestation can be associated with this infection? Okay, so if we go through the question carefully, we can see that there are 3 key clues in the question. The number 1 is walking barefoot. Walking barefoot increases the risk of parasitic infection that penetrate the skin. So specifically, we have hookworm larvae that enter the body by burrowing through the skin. Second is linear serpiginous erythematous rash. Serpiginous rash means a snake-like pattern or a creeping pattern. Again, this is a hallmark of cutaneous larva migraines, which is a condition caused by parasite like hookworm. These rash occurs as the larva migrate just beneath the skin and creating visible track. The third is respiratory symptoms. This indicates that the parasite is capable of traveling through the bloodstream to the lungs, causing pulmonary symptoms. So if we go through these 3 clues point us toward hookworm infection as the underlying cause. But this question isn't direct, right? They are asking clinical features associated with this infection. So let's learn more about this hookworm. As the name suggests, hookworms have hook-like teeth in their mouth, which they use to attach to the human intestine. And they perforate the mucosa, leading to internal bleeding. And over time, this chronic blood loss results in iron deficiency anemia. So the correct answer here is iron deficiency anemia. So next question is, a man from Bihar present with fever and skin lesions. On microscopy, an organism with a kinetoplast was seen. What is a causative agent? Okay, so in this question, the key clue here is the term kinetoplast. So first you should know what is kinetoplast. Kinetoplast is a unique structure that containing extra nuclear DNA. But the important thing is this kinetoplast is the hallmark of the family Trypanosomatidae. So to answer this question, you should know which parasites belong to this family. So just remember two important parasites, Leishmania and Trypanosoma species. Both have the kinetoplast structure. So if we look at the options, Leishmania is listed. So here in this case, the correct answer is Leishmania. Okay, so our last question. A patient presented with fever, cough and respiratory distress. On auscultation, crepitations were present and an X-ray showed consolidation in the right lower lobe of the lung. What is the most likely causative agent? So these are the options. If you read the question again, the patient has respiratory distress, which indicate a lung infection, but the X-ray shows consolidation, and this is the key clue here. What does consolidation mean? Consolidation refers to the lungs being filled with fluid or pus, which indicates that the patient has pneumonia. It means the answer of this question revolves around pneumonia. And this pneumonia is classified into two main types, typical pneumonia, atypical pneumonia. Typical pneumonia is always caused by bacteria. Just remember this, it is always caused by bacteria. And the another key point is consolidation is always present in typical pneumonia. The examples of bacteria causing typical pneumonia include Streptococcus pneumoniae, which is the most common one, followed by Staphylococcus aureus, Acinetobacter. So the point to remember here is typical pneumonia is always caused by bacteria and consolidation is always present in typical pneumonia. I think you might have figured out the correct answer here, but to make it more simple, let's understand atypical pneumonia. Atypical pneumonia can be caused by bacteria, viruses, fungi, and parasites. And remember that no consolidation is present in atypical pneumonia. So few of the examples here, like bacteria, Mycoplasma pneumoniae, viruses, coronavirus, influenza, fungi, Pneumocystis jirovecii, and some parasites. So these are responsible for atypical pneumonia. So if you analyze the question again, it clearly mentions consolidation. It means the patient has typical pneumonia, and typical pneumonia is always caused by bacteria, and the most common one is Streptococcus pneumoniae, and Streptococcus pneumoniae is listed in the option. So your answer here is Streptococcus pneumoniae. The other options fall under the atypical pneumonia category. Alright, that's all for this video. If you found it helpful, don't forget to hit the like button, subscribe to my channel and share the video with your friends. Thanks for watching. See you in the next one.